Happy Father's Day. I'm just on my walk before I take a dip in the pool. On my walk, I like to reflect. I was reflecting on something cool that happened this week. A lot of times people believe that a clinic like mine, a wellness center where we do acupuncture and use some of these other therapies, is all about reducing pain, that's a big part of it. But really there's a bigger thing that we're about, which is making the body work better. And we got a really cool example of that this week. There was a patient who was dealing with some pretty chronic constipation and nausea. And this was to the point where, like, sometimes you think, like, you know, if you hear somebody only evacuates their bowels once every 3-4 days, twice a week, like, that's already a problem. We were working with somebody who only evacuated their bowels like every 2 to 3 weeks. And when they did that, it still didn't really feel like a full elimination. Clearly, that's a big problem. And so they got started working with us. And as usual, we don't know what's going to happen immediately, but we know we can often get some pretty big changes. Well, anyways, something marvelous happened. The person came in on a Monday, and they came back on Wednesday. And when they came back on Wednesday, they said that they had had a successful elimination of their bowels both Monday and Tuesday. And then we saw them early in the day on Wednesday, so I'm not sure what happened then, but we'll see them again this week. But anyways, think about that. From once every 2 to 3 weeks and not really feeling like it was a full elimination, to then daily after the days following the treatment. And it's not like we, like went in and did something magical. Like, we just did what we need to do to get the body to work better. When the body works better, then the systems all perform the way they should. What a remarkable result. Pretty amazing. And another reminder that the stuff we do is not just about helping to reduce pain. We can do so much more. We get the body to work better.